To begin our Insurance 101 course, let's define some common insurance terms. The first three of these terms fall under the general heading of copay in industry terms. In other words, they are all methods by which the policyholder participates in the cost of their own medical expenses. The most common word is deductible, which is the term most people are familiar with. Deductible is the amount of money the policyholder spends out of pocket for medical services each year before their insurance begins to provide financial support. The average annual deductible for a silver level insurance plan is between $5,000 and $6,000 for an individual and twice that for a couple. A silver plan is a middle-of-the-road plan purchased by most consumers. Bronze would be a low-cost plan, and gold or platinum, more expensive executive-level plans. There are exceptions to the deductibles, such as copay for a primary care office visit, where the policyholder will cover a small initial amount of the appointment cost, and the insurance company pays the rest, regardless of whether the policyholder has met their annual deductible. Every policy will disclose these copay-related services. Another form of copayment is called coinsurance. This is a term most policyholders don't understand. Coinsurance becomes effective once the policyholder has paid in their annual deductible each year. It is a percentage of medical expenses paid by the policyholder until the out-of-pocket annual maximum for the policyholder is reached. For example, if a plan has a $5,000 annual deductible and the policyholder has paid out of pocket medical expenses exceeding that $5,000 in a given year, the policyholder will now be responsible for paying a coinsurance as an additional out-of-pocket expense. The coinsurance rate for a silver plan is typically 30% of any additional expenses. As the last of the three, not to confuse it with the overall concept of copayment, the last of three terms that fall under the general category of copayment. In this application, it mostly refers to the initial amount of the cost of a primary care office visit that is paid by the policyholder. The insurance will cover the remaining cost of the office visit, but may not cover expenses resulting from additional services provided during the appointment, such as x-rays or lab work. A typical copay for a silver plan is $60. Copayments can also be associated with major medical services, such as the cost of an overnight stay in a hospital room, imaging services, or lab services. The national average cost of a hospital room is just over $3,000 per night, and copay for a silver plan can be $400 to $600 per night. That's your out-of-pocket for those type of expenses. Then we move towards annual maximum, which is a government-established limit on the amount of out-of-pocket expense a policyholder can be responsible for each year. When this limit is reached, the insurance company pays 100% of all additional covered expenses. The annual maximum for an individual silver plan is around $9,500, and for a couple, it's about $18,500. The next term is one you're familiar with. It's premium. The premium is the monthly cost of an insurance policy. An insurance policy is a contractual agreement between the insurance company and the policyholder, and the premium is the amount the policyholder pays for that financial protection provided by that contract. Premiums can vary significantly depending on a number of conditions. The Kaiser Family Foundation is a great resource for information and statistics about the healthcare industry. They have a health insurance marketplace calculator. You can do a web search on health insurance marketplace calculator, or we put a slide on the screen with the actual URL if you want to copy that down. This calculator can be very helpful when you're comparison shopping. It's broken down state by state and has a lot of variables that you can plug in, but it's very accurate. The last term we'll discuss is pre-existing conditions. Prior to the Affordable Care Act, people had medical conditions prior to their purchase of an insurance policy were rated, and their premiums were adjusted in consideration of their pre-existing medical condition. In other words, unhealthy people paid a higher price for insurance. After the Affordable Care Act, insurance companies can no longer consider pre-existing conditions in the calculation of their insurance premiums. Common pre-existing conditions are typically chronic illnesses like diabetes, heart disease, or cancer, but it can be a short-term illness that is curable. And pre-existing conditions, this Affordable Care Act requirement for pre-existing conditions is for both individual policies and group policies that employers might use.